Okay, today we're at our Palmetto Bone and Joint Irmo office location. Again, we're going to be seeing lots of patients today. We got a pretty busy schedule, a lot of new patients, a lot of follow-ups for existing problems and follow-up from surgery. So busy day, so let's go get started. Hey, good morning. I'm doing good. How are you?
I'm good.
You're good?
Yeah.
How's the knee doing?
It's all bubbled.
Did the gel help at all? Or
Gel helps.
helps a good bit?
Yeah, gel helps a lot.
Good.
Yeah.
Good. And we're going to do a cortisone today
Yeah.
to try to help calm it down some? Or
Oh, okay. I thought
it's up to you.
Yeah, cortisone's fine. I thought I did the gel.
So the gel is every 6 months.
Oh, okay.
Yeah, so we did it back in so we did it back in May, so we can do it again in another 3 months.
Okay.
And so we'll go ahead and get that scheduled to do the gel again.
Okay.
But yeah, we could do cortisone today just to try to help give you a little relief
Okay.
between now and
Okay,
then.
that'll help.
Sound good?
Yes.
Okay. Yeah, it is all
Yeah.
bubbled out, isn't it?
I fell at work about a month ago.
Really?
The whole day was all bruised, but they sent me to the other doctor, the work doctor, but there was nothing broken, they said.
Oh, well, that's good.
Yeah.
Was that from the fall, or is that just from the arthritis?
No, I think that's just from the arthritis.
From the arthritis, okay.
Yeah.
All right, cold spray, okay.
Yep.
All right, it's gonna be a stick here. Doing okay?
Yeah.
Okay, we're all done.
You're so good.
Oh, thank you. I try to be gentle.
You are. That doesn't hurt at all.
Good. Well, take it easy today,
I will.
okay?
Well, I have to vacuum at work, so is that? Brace on?
Yeah, if you put the brace on and then just try to avoid a lot of twisting on that knee.
Twisting.
It's more the twisting, then you should be fine.
Should be okay.
Yeah.
All right. Well, thank you very much.
You're welcome.
I hope you have a great day.
I hope you do too. And then, like I said, I'll have them get you that appointment for 3 months, which should put us October, November. Yep.
Yeah.
So put us in time for our gel again.
Okay.
Sound good?
Okay. Sounds good.
And the hip completely bone on bone, lots of bone spurs around the edge of the joint, so definitely has reason to be hurting with it. Hello, good morning. How are you?
I'm good. How
Dr.
are you,
Logging,
sir?
nice to see you.
Yeah, nice to meet you.
All right, this is Caitlin. She's my assistant helping me.
Hi, Caitlin.
What's going on?
Well, I've had my left hip replaced, both my knees at the same time.
Right.
But of late, we'll fast forward because that was in 19.
Okay.
This has been bothering me because for 5 months I've been
On that.
literally on that.
What'd you have done on the ankle or foot?
It has. I went into this on purpose to answer that question.
Okay.
So I have patchy stress marrow edema
Okay.
and microtrabecular fractures.
Okay.
Distributed the tarsal bones and metatarsals involving third and fourth metatarsal, next cuboid, cancanial tuberosity, and second metatarsal base.
Right.
But when I went in after the 4 weeks and got my cast off, I waited 2 weeks, like you said, and then I was playing with walking. And within 2 weeks, it just went boom. This thing was 3 times the size
Really?
of this.
Oh.
So they put on here that this RSD, chronic regional pain syndrome,
no.
was part of it. Anyway, that was my second bout because for another 6-8 weeks before that, I was on this with another ortho doctor. Then I went to the man that I'm going to now.
Okay.
But he told me he couldn't do any more for me, and I'm with a rheumatologist.
Okay.
So I'm working on that. They're telling me and want me to take those heavy-duty drugs.
Right.
And I'm not into it.
Yeah, sure.
So I've been on YouTube.
Okay.
With other doctors that with healthy eating, which I've always done anyway. I just really cut the sugar out this bout.
Right.
You know, we all love chocolate, right?
Right.
So it's getting better
Okay.
every day.
Okay,
It has,
good.
And I can now tolerate a little bit of pressure
Okay.
to kind of get in and out of my car.
Okay.
I get this. But it's aggravated this hip
Sure.
to the max. I mean, it was getting bad 4 years ago.
Right.
And they told me, and the 3 doctors I've seen since, one of them was here, and that was over at Lexington. But that was like a year ago.
Okay.
But he said, you know, if it starts hurting, but you do anterior, and he didn't.
Right.
And I know Donna Dennis.
Yep.
She just loves you.
Oh.
And she told me her experience with the last procedure you did on her.
Right.
And of course you're doing another one. And she was all over that anterior
Yep.
business.
No, it makes a big difference.
So I looked it up and I was like, well, okay, I'm sold.
Okay.
Yeah. So it's just constant pain, especially when I lay on this side.
Right.
It just jabs. And it's poking and it hurts.
Sure.
And then when I scoot on this thing,
Yeah.
you got to put your foot out here.
Right.
I do, or else you have to take a little baby steps. It's just
And it really kills it.
cranks it.
Yeah.
Yeah.
Well, I'm sorry you're having all the trouble with the foot. I hope
Well-
that keeps getting better, but
Well, yeah, they just tell me I'm old and I have osteopenia and I better take a heavy duty drug.
Oh.
I'm not into it.
can I move that hip around? Does it
Yeah,
hurt?
you know what? That's what it does. It shoots down to my knee.
Down to your knee? Yeah. Does that
And
hurt
that's
to
been
bend
doing
it?
that for a year.
Turning it in, hurt it a little bit. Not too bad.
I mean,
Out,
whoa,
right
I don't
there.
like that.
Okay. I don't want to torture you with it.
Thank you.
Yeah. Well, here's the X-ray on your hip. Okay. So here's your hip replacement on your left side. What we're typically looking at is the amount of space between the two bones. And you can see very little space out through here, completely gone through here, so it's completely bone on bone in this area. Big bone spurs here on the outside part of the ball, one on the outside part of the socket. So as you move your hip and try to move it, those spurs are, those spurs are hitting together.
You know, they told me I had those spurs, and that's what I thought I was feeling.
Yeah.
But I wanted to.
Yeah, so you've got spurs kind of all around, but it's it's completely bone on bone. And then obviously compensating for the foot on the other side, you're putting so much weight on that one.
Well,
and that's
the derivative.
Yeah.
Although I was told that you get up pretty fast.
Right.
You can walk with this one. So I wanted your big opinion on how this may work.
Yeah.
Do I have to wait? Could this happen?
I think it's definitely possible. It's not the ideal situation for you to have the issues with the foot because you are up and around a lot quicker. But at least initially, you may be putting still a little bit more weight on this side, which may aggravate it and make it worse. Although you can put full weight on the right side right away afterwards. And so it's not the ideal situation, but it's definitely manageable.
Especially if I'm still on this cart.
Correct, yeah.
So that wouldn't be
a great idea.
It's going to ruin what you're doing here and not work well with my alignment.
It's just, it's going to just affect your recovery. You may put too much strain on it or something like that. So it's not the ideal situation to still be on the scooter when we get to that point. Now you could still be in the boot, although the boot still throws you off a little bit because it has a pretty big heel on the bottom of the boot. Which,
well, that's why I run around and...
Gotcha. Well, at least you're trying to balance it out. So
yes.
So it's definitely doable. Now my schedule is a few months out anyway, so that would give you time to let this continue to heal a little bit more. So I think it's manageable, and it may be that it gets to a point where you can get off the scooter and you'd be in a better position to where you could have the hip replacement. But I think it's definitely doable.
Okay, so I can schedule one now.
Mm-hmm.
If we're getting closer to that, I can let you know whether it's going to work.
That's correct.
Or we're going to wait a little bit more.
That's right. Yeah, if you feel like you're not comfortable, it's like, this foot's not making the progress I thought it would, we can always push it back.
Okay, now what about this recovery.
Yep. So typically, the anterior approach, we come from the front, little small incision, but the benefit is we don't cut the muscle, and so that makes the recovery a lot easier to get over. So with your other side, I'm assuming they did posterior approach with that one.
Yeah.
Yeah. So they, wouldn't let you bend it, but so far, things like that.
25 and worked my way up.
Yeah. So those restrictions don't apply to this one because we don't cut the muscle. You can move it as freely as you want right away, which is nice. So things like sitting in a chair and that kind of stuff, there's no precautions you have to take. You can put full weight on it right away afterwards. Most people will use a walker for about a week, and then a cane for a week or two after that. So 2 or 3 weeks, you're getting around pretty good, usually already feeling better than you did before surgery, but still some soreness and swelling. Obviously takes a few months for that to fade away. By 6 weeks though, you're back doing pretty much whatever you want to do. So recovery is pretty quick, whereas the other one, it was 6 weeks before they let you start moving it normally. And so you're gonna make a lot faster progress. And hopefully then, because you can make faster progress, put more weight on this side, that won't put too much strain on the foot on the other side.
Right, hence why it's good to be pretty much off of this.
Correct, it would be good, yes.
Okay, all right, well, I'll do my best with my healing over here to achieve that. But it sounds good with me, the whole recovery. Plus Donna is just your best gal. She
Well,
really
good.
is. I just love her.
Yeah, she's sweet. So.
Yeah. Okay, well,
Well, do you want to think about it, or do you want to go ahead and talk to the scheduler?
I have to have it done.
Yeah, it's in pretty bad shape, so I know it's giving you trouble for sure.
Yeah, it's not fun what's happening here.
Right.
So you're a couple months out.
Yes.
And where does the procedure take place?
So we do it one of two places. So we either do it at our surgery center in Chapin. If we do it there, it is outpatient, so people have it done and go home the same day. But we also do it at Newberry Hospital. If we do it there, then usually people stay overnight and go home the next day.
Okay.
So totally your preference on where you'd rather do it. But it's just whether you'd want to stay overnight or try to go home the same day. With the foot issues, it may be better to stay overnight. That way therapy can kind of work with you, make sure you're doing okay.
That I did.
Yeah.
And then my daughter can just handle me. And
Sure.
Okay.
That sound like a plan?
Newberry.
Okay. All right, well, come on up here with me and we'll go talk to our scheduler and see what we can work out for you, okay?
Okay, here's all my paperwork.
Okay, we can give that to him.
Okay, nice to meet you.
You too. We'll get you feeling better, okay?
Oh, yeah, I'm looking forward to it, believe you me.
All right, so new patient with left knee pain. They've already had a replacement on their right side. Pretty severe arthritis on the left, completely bone on bone through there. They have an MRI, which shows tearing of the meniscus, which you wouldn't be too surprised by given how severe the arthritis is. And then obviously pretty advanced arthritis and degenerative changes throughout the knee. All right, so we'll go talk to him and see kind of how things are doing. Hello.
Hey,
how are you,
how
sir?
you
I'm doing good. You doing all right?
Doing great, sir.
Good. This is Caitlin. She's my assistant helping
Hello,
me.
Caitlin. How are you?
Well, what's going on?
I can't get in touch with
With who?
Marvin Gaye.
Oh,
Yes, what's going on?
what's going on? That's funny.
I want to see how cool.
I like it.
You got that one, didn't you?
Oh,
A lot
yeah.
of people don't get it, dog.
Yeah.
I'm gonna give it to you. You quick with it. Quick man.
I like it.
Yeah. Okay, so I had this knee replaced
Mm-hmm.
in 2022.
Okay.
So, and I've been to my orthopedic doctor, blah, blah, blah. I said, this is bone on bone also. Okay?
Yep.
So, I read about Dr. Patel, new procedure that I wish I had known before I had this one.
Yep.
And I like what I read, and I like the testimonies and stuff, and I'm interested in proceeding. And,
Okay.
And tell me what you think.
Okay.
You saw the X-ray.
I
the
did.
MRI.
Yep.
Okay.
And have you had injections and things in it?
I done had PRP. I done had hyaluronic acid. Did all that.
Okay, gotcha. Can I take a peek at it?
Yes, sir.
And when you get pain, is it more like to the inside, outside, or just kind of all over on that inside? Okay, good. Alrighty. Well, here are the x-rays on both of your knees. So here's your replacement on your right one, and this is your left knee, and what we're typically looking at is the amount of space between the two bones.
That's correct.
And you can see here on the inside part of the knee, which is where most of that pain is, there's just no cartilage left. And so it is completely bone on bone. And then the MRI that you had done obviously shows, pretty advanced arthritis in the knee, but it does also show that you do have a tear of that meniscus that's in there as well. And that just kind of makes things worse, just amplifies the problems that are there. So once it gets to that point, meniscus is torn, it's completely bone on bone, knee replacement would be the only option to fix it long term. So that's probably going to be the best thing for you. You've been trying the injections, they're just not really doing the trick for you. And so the replacement's going to probably be the best option. So the difference in the way, I do it with the Jiffy technique like Dr. Patel created and what you had before is when they make that incision down the center of the knee, they cut into the tendon and muscle.
That's correct.
Yeah, and then you're doing therapy, but the tendon's been cut, so it hurts and it's hard to get the mobility back. And
that's correct.
Yeah, and so that's why it takes so long to get over. So with the Jiffy technique, is we're coming more from the inside, so the incision's more over here. We avoid cutting into that muscle and tendon altogether, so that helps make the recovery quicker return to mobility and muscle function, and then usually less pain as well. Still a knee replacement, but comparatively the recovery is much better. People who typically have had one done the traditional way and then we do the Jiffy technique on the other, they're like, man, it's night and day difference between the two. So it just makes a big difference. What you find is you just make faster progress. And then usually, like I said, pain's usually a lot less too because you're not cutting into that tendon. So recovery, you're up and walking right away afterwards. You can put weight on it and move it. Most people will use a walker for maybe a week and then a cane for a week or two after that. So 2 or 3 weeks, you're getting around pretty good. There's still a fair amount of soreness and swelling that's there. That really takes about 3 months for that to kind of fade away. But activity-wise, by 6 weeks, you're back doing most things you want to do. So you're up and around with therapy right away afterwards.
Okay. Yeah, because I'm a tennis player.
Okay, good.
I'm trying to get back to the
Absolutely.
tennis court.
I hear you. Yeah, so typically for like playing things like tennis and stuff, people can start going back to playing tennis by 6 weeks.
Really?
Mm-hmm. Yeah, now you're not out there. No, we have you back playing tennis before then for sure. Now you're not out there.
6 months I'll be good.
6 months you should be really good.
Okay, yeah, because I'll wait 6 months.
Okay. Yeah, but we can get you back. Yeah, I want to see you out there playing some tennis. So.
Yeah.
Well, any questions about anything, or do you want to go ahead and talk to the scheduler to see about trying to get it scheduled? Okay.
Yes,
all right, well, come on up here with me and we'll see what we can go get worked out for you, okay?
Okay, and I wanted to ask you.
Yeah.
You say you're a pilot?
I am.
And also a photographer?
I am. Yeah, all these pictures.
And a TV celebrity?
Well.
Dog, you got it going on.
We're trying. We're trying. All right, well, come on up this way with me.
All right.
And you're from Georgia?
Augusta.
Mm-hmm. Yeah, so not too far.
No.
It was about 45 minutes out.
As a matter of fact, I was trying to think, I called my friend, right? And you did her surgery. She was from Atlanta. She's a nurse practitioner.
Okay.
And you must have did it maybe 3 months ago. And she had did all the research and stuff and whatnot. And she said that's the best way to go with Dr. Logan and the Jiffy knee and stuff.
Well, good. Good. Yeah.
So your reputation is getting, and I'm spreading in Augusta. All my older people like me, I know. You didn't know I was that old, did you?
No.
Huh?
I would have never guessed it. Look at him. He's fit. He looks good.
Come on up.
I like it.
Yeah, she had it and stuff, and of course I had already did my research and stuff, and this is the way I want to go, Doc.
Yeah. I don't blame you. It's made a big difference for people. So, all right, well, come on up here. We'll go talk to her.
Okay.
And we're going to head down and around this way, okay?
All right.
Hey, how are you? Hanging in there? A lot of pain. Well, how did the shots do last time?
Did good last time.
Okay.
They got me for like, I guess about a month or something.
Okay.
Now, I'm in PT because I had the heart stent.
Right.
And you gave me the injections. But now it's like my back, I'm like 7+.
And it's like, since the exercise seems like it's making it
Aggravating the back.
up the speed on my treadmill and everything.
Right.
So is that what it's doing, aggravating my back?
Probably, unfortunately. I mean, they want you to do that to help with the heart, but then then it's causing issues in the other. Did you ever end up getting the injection in the back?
No, that is planned for September.
Okay.
But this is the thing. The injections. One was a steroid, right?
Mm-hmm.
And the other was
The gel. That's right.
And you said the gel was a one-time thing.
The gel you can do every 6 months. So yeah, we wouldn't be able to do it today, but you could get it again in another few months. The gel, usually we get longer relief. I hate that you only got really about a month out of it, and that was probably more the cortisone that did that, because the gel takes about a month to really start taking effect. So it sounds like the gel maybe didn't do a lot. It probably helped some, it's just not enough.
Yeah, this was the really bad one. I was supposed to have surgery, and I had several injections with the gel, and it's good.
It's good, good.
But something is going on it's my back
Yep.
and my whole leg.
Yep.
It's like pain. It's like I can't rest at night. It's like throbbing in
Right.
the bed. You know when you have like a bad cramp and it comes out in the way it feels? That's the way it's doing. It feels almost like it's in my bone.
Right, yeah. I think that's the nerve in the back, so you probably got that nerve getting pinched. Was there a reason we waited till September, or is that the earliest they could do it, or?
Because I'm on blood thinner.
Because of the blood thinner, and that was the soonest they would let you.
The thing I had, okay, I would love to have that shot.
Yeah.
After I had the shot, my heart went into AFib for like 14 hours. First it was bradycardia, and then AFib for 14 hours.
Oh, wow.
So I called my heart doctor, and they wanted to know what kind of injection. And I said, I don't know the name of it.
Yeah.
They would say there's different kind of steroids.
There are, yep.
And so, is there a kind that would not affect my AFib?
Yeah, it's hard to say.
She said steroids could affect my AFib.
Correct, yeah. The one we used last time is Depomedrol. That's kind of the standard one we typically use. But there's also Celestone, which is a different type of steroid. We could try just the different one and just see if it does differently. It may do exactly the same though.
Can you write down the name of it? Let me talk to my cardiologist and see which one I can get.
Yep.
I can't deal with this pain.
I understand.
I'm going to Virginia to visit my son for 2 weeks. That's a long drive.
Let's see. Okay, so you can let them know this is what you got last time. Okay. So the Depomedrol, which is methylprednisolone, and then other option we've got is betamethasone. So that's the other one.
Steroids.
So those are the two that we have typically.
Just don't want that to happen again.
Yeah, I don't blame you. So you could see, I mean, like I said, it's possible we switch, it wouldn't do it, but it's possible we switch and it still does it. Because I mean, they're both steroids, so you may get the same result, but you can just ask them and see what they think.
So I should cancel the back injection right now?
Well, I mean, I'd ask them, see what they think about it. And so, if it puts you in the AFib for a short period of time, then, is that safe enough to where, because the benefit you may get from it, if it's only like 12 hours, then the benefit you get from it may be worth, having to go through that. Now they may say no, that we don't want to do that, but I feel like a lot of what you're experiencing pain-wise is related to the back. So if we could get that injection, that would help you a lot with the pain.
Well, if I can't get an injection, then what do I have to do?
Then the only other option would be surgery.
Ooh,
Yeah.
on the back.
Yep. You're in a tough spot. I know.
Yeah, because it helped me so much, that injection.
I know it did.
Okay, now I'm going to be the traveling part.
Okay.
Up to Virginia.
Okay.
Can I get any kind of like pain medicine to help me?
So I can't do like a narcotic pain medicine. We can do like anti-inflammatory pain medicines, but if you're on the blood thinner, a lot of times they don't want you to take those because of the blood thinner. So you're in a tough spot.
I am in a tough spot.
You're in a tough spot.
Okay.
I know. And normally I would, people when they have nerve pain like that, I would put them on like on a prednisone pack, but then we're right back to the steroid issue. Now we could put you on like Neurontin or gabapentin. I don't know if you've tried that before, but gabapentin is a nerve calming medicine, and so for people who do have pinched nerves, it can potentially help calm the pain from the nerve down. So we could definitely try that. That wouldn't have any interaction with your blood thinner or anything like that. So that may be worth trying and see if that would help.
Back in June, because I was on a package my doctor gave me. Family doctor, the 7. And it didn't put me into AFib.
It didn't, yeah. That's a steroid, so just depends on which one they gave you.
Which would be best for me to take with me up there? Release some of this.
Well, I would probably say take the gabapentin for sure. So we can call that in, and then I could call you in a prednisone, dose pack, and just see if you got really in a tough spot. You could try it and just see what it did for you, whether it affected you.
Take them both.
You can take them both.
Okay, can I do that?
Yep, you sure can.
I don't want to get up there.
Yeah, no, I understand.
They got big 3-story house.
Oh gosh.
There's another basement with a whole apartment.
Okay, very nice. All right, what pharmacy you want me to send that to?
Hawthorne's.
Okay.
And Pillion.
And Pillion, okay. All right, so we'll send that in there, and then talk with your cardiologist, and then if you decide, he says, yeah, let's try the other one, just give us a call, come back, we'll put a shot in the knee, or get, I'd keep the one on the back scheduled for now, just in case, in case that that works out, because I feel like that's going to help you if we can get it.
Yeah, they're going to have to do something. I can't deal with this.
I understand.
Thank you, Dr. Loggins, so much for your help.
You're welcome. I hate you're having such a hard time with it.
I go to PT trying to make myself better,
then it makes it worse. I know. That's frustrating. Alrighty.
I did, like you said, though, I told them not to put my elevation.
Yep.
So they brought my elevation back down.
Perfect.
Now they speed up.
Oh gosh. They don't need to be torturing you. All right, well, if you give that to them up front, they'll get you checked out, okay?
Thank you so much.
You're welcome. Hang in there.
Have a good
Okay, so new patient, 61-year-old, right hip pain. Again, pretty severe arthritis of the right hip. Completely bone on bone. The ball's really kind of misshapen. Bone quality looks really poor just from how he's got so many subchondral cysts in the bone. Left hip is not as bad, but it's almost bone on bone as well. So pretty severe arthritis on that right one though. Hello, how are you, sir? Dr. Logging, nice to see you. All right, this is Caitlin. She's my assistant helping me.
How you doing?
What's going on?
Just bad hip.
Bad hip? How long's it been bothering you?
Over 2 years now.
Okay. Just kind of started one day, or
Well, I had
any
both my
injury?
knees done in 2019. I broke this leg in 5 places back in '82.
Yikes.
So I've always kind of favored or asked a lot of this leg.
Right.
Since 1995, my knees have hurt so bad. I've taken goodies and BC powders, 2-3 times a day. I should have had my knees done earlier, just waited. And so I finally got my knees done, and then now my hip freaking hurts.
Right. Oh, I'm sorry.
I've seen another doctor in Chapin. BMI's got to be 40. And I'm right like a 47.
Okay.
48 right now. So
Okay.
it's you're 45. I know it doesn't seem like much. 20-30 pounds doesn't seem like much, but I can see a light.
Yeah, right.
In a tunnel. I've been overweight my whole life. I've had gastric bypass surgery.
Okay.
I was 626 pounds.
Wow. So you've come a long way.
Got down to 280. In 2002, I had a gastric bypass. 2005, I was 280. And then I got back up to like 430. I've been about 415 this bringing the year, but I should be around 400 right now. So,
Right.
like I said, I know I can.
You can get,
I
get
just
where you
know
need to be.
I can't live my life like my freaking not doing
Right.
my hip is just. I see Dr. Haas across the street. I take 3 pain pills a day just to
Right. What pain medicine do you take?
hydrocodone. I
Yeah.
take 3. I take
3 a day?
almost 2 in the morning just to get out of bed to get started. Because
Yeah.
I know once you get out of bed, I'm sitting right now. I feel, pretty good. I don't feel as soon as I freaking put my foot on it now.
Right.
That being said, I've been a walker with wheels since 2018-ish. Been on crutches since 2019. So now my legs are weak as hell because I'm trying to take the weight off my hip, put it on my legs. and
Sure.
My legs are freaking sore.
Right.
So it's just a miserable freaking situation, man. So I just want to get
I'm
my hip
sorry.
taken care of, get back to my normal bubbly self. Cause
Right. I understand. Can I move
I'm
that?
getting asked, I'm getting a signing bonus. Or,
That's right. That's right.
That.
Can I move this hip
Yeah.
around?
Ow.
Is it pretty limited on mobility? Does that hurt?
It's starting to.
Starting to. And when you get pain, where is all the pain? Like in the groin area or more to the outside?
Inside.
Okay. Does the other one bother you at all?
No.
All right, well, here are the x-rays on both of your hips, okay? So this is is the right one here, this is the left one. You know, what we're typically looking at is, the amount of space between the 2 bones. Now your left hip, you can see there's a little space, but not much. And so you do have a good bit of arthritis in that one, but if we compare it to over here, there's no space whatsoever. And then when you look at this, this one's pretty much still a ball. This one's more like an egg shaped because it's been eroded down from just where the 2 bones have been grinding together. So that one's definitely in pretty bad shape. Let's see. All right, so currently, height-wise, you're 5'6", or
6'4".
6'4". Yeah. Okay. Sorry.
Shrinking.
Yeah, and shrinking. And then you weigh how much?
A good day, 400, 401.
Okay.
402. I can't break the 399, it seems like, but I will next week.
All right. So we said 401. So that does put you right at 49 for the BMI. So to go from 49 to 40, that's a big jump. To go from 49 to 45 is definitely more manageable.
Yes.
That's the hospital. We used to not have that limitation, but they've instituted that BMI rule.
I've had both my knees done at the 400 pounds. So
Yeah.
I've had 2 screws put in my toes.
Oh,
I
goodness.
had 2 operations of my knee because of infections.
Right. So let's see if we got
But they're
to-
saying because the hip has got so much more skin or fat to go through that's harder to do than the knees are. Is that true?
No, not really,
That's
but
what Dr. told me.
so the biggest thing for me, the way that I do my hip replacements, I do what's called an anterior approach, which means I come from the front part of the hip. So it's a little small incision, but the benefit of that is we don't cut the muscle, so it does make the recovery about half the time. Now, the only problem with that with somebody who is a heavier weight is that incision sits right here, and if you've got a belly, then that belly a lot of times will fall right over the top of that incision. And so if it gets trapped underneath your fold there, it can sweat, it gets moist, and then get infection. So that's the biggest concern with it. And so what we have to make sure is you try to keep that area open, let it get air, dry out, or keep gauze or something on it so it stays dry. And then once it's healed, then you're home free. Then you don't have to worry about it anymore. But it's those first couple weeks, make sure we protect it, let it to heal, and then you're home free. When you look at your leg itself, there's no issue with the leg in doing the surgery. We wouldn't have any problems with that. That's the biggest concern from that. Now, obviously getting to a 45 BMI wouldn't change probably the belly that much. So we're still going to have that issue regardless of the BMI, but...
You do a tummy tuck while you're in there.
That's right, we could.
Throw it in, man, 2 for 1.
2 for 1. But if we look at, trying to get you down to a 45, that's a weight of around 370. So you'd have to lose about 30, 35 pounds, somewhere in that range, which is definitely more manageable. Yeah. Now, my surgery schedule is booked out a few months.
Oh, I heard.
Yeah. So, but the good thing about that is that would give you plenty of time to try to work on that. So we could go ahead and get it scheduled.
Yes.
Now, if for some reason, say you didn't lose any, Okay, the hospital's going to cancel it. I mean, without a doubt. And that's not me, but they're going to cancel it, because if you're not under that limit, they're not going to let you have it. So, really encourage you to try to work as hard as you can to get there.
Once you say, yeah, man, you're happy, next time I see you, or
Yep.
I see you again a month or two before the surgery,
Right.
I'm losing the weight.
Right.
And I'm going to say, hey, yeah. So I want you to put me on a schedule. Then, of course, you're going to get cancellation probably. Sometimes someone's going to cancel out. You call me, I can be there in 20 minutes.
Gotcha. Well, do you want to go ahead and talk to the scheduler to see about trying?
Absolutely.
Okay. Any questions I haven't answered?
This is all free, right?
It's what?
It's free to have on TV, right?
That's right. Well, maybe not quite that way, but.
Where's the surgery?
So we would do it at Newberry Hospital.
Newberry,
Yeah.
So this is Prism.
Nope, they're independent, so they're their own system, so not related to Prisma. Yep.
Who else? Okay.
All right, well, come on up here and we'll go talk to our scheduler, okay? All right, 68-year-old right hip pain. Does have some arthritis in the hip, so it's moderate. Gets really thin here towards the inside. It's not end stage, but definitely has some arthritis. There's no MRI or anything, is it? Definitely has some arthritis and degenerative disc disease in her lower back. I don't know if it's like part of a belt or something, or what that is. I think this is a battery.
Yeah, it's something in there.
Yeah.
What would that be?
It's nothing like, I've never seen like a stimulator or anything look like that, so I'm not sure what that is. Hello, hey.
How are you?
I'm doing good. Dr. Locking, nice to see you. You're in here stretching it out. Well, what's going on?
Started a few months ago.
Uh-huh.
And I was doing Tai Chi.
Okay.
Real simple move against the wall, doing a twist
Right.
to the wall. And all of a sudden it was a pull pop.
Mm-hmm.
And it started hurting.
Right.
And I thought, stretch it out.
Right.
Work with it, give it some rest, lay off of doing that excessive stretch.
Sure.
And it would get better. It hasn't.
Okay. And that happened when? How long ago?
Probably February.
Okay, so it's been a while.
It's been a while.
Okay, so you've given it a lot of time to
Yes.
try to get better.
I have done anything and everything because I've had a martial artist.
Uh-huh.
So I've had all kinds of broken bones, torn ligaments.
Oh my
and
gosh.
All kinds of stuff.
Right.
So I'm used to the pain,
Sure.
but this, and I think he got real concerned because I'm having numbness
Mm-hmm.
down this side of the leg.
Right.
Burning. And it usually aches every now and then if I go to get up too fast without letting it relax into it. And it doesn't want to work right.
Gotcha. How does it feel when you're like doing the stretching like that? Does that
Really
seem,
good.
it makes it feel better?
Really good.
Okay.
That's why I'm constantly
Stretching.
I've always stretched.
Yeah,
and
which is good.
I do that, and I have a exercise ball.
Uh-huh.
That's what I normally sit on, especially in the morning when I'm drinking my coffee.
Right.
I sit on the exercise ball up against the coffee table,
Uh-huh.
and I can do a full split,
Wow.
and I can sit there and drink my coffee and hold that.
Wow. That's
And
pretty impressive.
I can still do a full split.
Yeah.
I can still do all of that, but it's one of those that when you go to put weight on it, you go to move, then
when it grabs you.
And it hurts from here all the way up into here.
Okay. Can I move that hip around?
Yes, absolutely.
Does it hurt for me to bend it?
There, I can
Feel it a little bit there?
I feel a bit of a numbness in here.
Okay. How about turning in? Like that. Does that hurt it? Nope. Turning out?
There,
There a
right
little
when
bit?
you get to that point.
In that same spot?
In that, that is here.
Kind of more back in there. All right. And the numbness, is that just in that outside part of the hip?
That's it.
Okay.
And it's normally if I stand in one place too long. Now I will say that we have done a leg venal scan.
Uh-huh.
We did come up with loss in this one, but it was very mild.
Okay. Well, these are the x-rays on both of your hips. So this is your right one, this is your left one. You know, what we're typically looking at is the amount of space between the ball and the socket.
Right.
And you can see out towards the outside, there's still a fair amount of space. Although when you get towards the inside, that space starts to get much narrower. So those lines are coming together. And so you do have some arthritis in the hip.
Oh, that's what's going on.
Yeah, so that's part of it. Now, sometimes as you get arthritis in the hip, there's a cartilage rim that runs around the socket that's called the labrum. And so, you know, sometimes, especially if, you know, for somebody who does a lot of stretching, like really hard stretching, as that neck of the femur comes, as you're stretching that, it hits up against that labrum and it can cause that labrum to tear. And so my fear is that that may be in what you noticed when you felt that kind of pop in the hip and that pain is the labrum tore. And then now you've just got this pain from that torn labrum. Sometimes the labrum can heal, a lot of times it doesn't.
What
and it just
helps it to heal?
Well, it's just time is the biggest thing on it, but you've given it a good bit of time. So what I would probably...
Have I aggravated it?
By continuing to do the things. Possibly. You know, what I would probably recommend we do is just to try to help verify if that's what's going on, is set you up to get an MRI on the hip, especially since it's been going on for so long. Now, you do have that numbness. You know, sometimes numbness can be related to a nerve issue, so I mean, it's possible it could be a pinched nerve or something like that as well.
I was wondering about that because I also I have scoliosis. But I've been able to battle that
Manage
by
that.
strong muscles,
Good.
strong core.
Yep, that makes a difference for sure.
I haven't really caved into that.
Yep.
But
we could get an MRI to check the hip, the lower back, and just see is there anything there that would be causing that.
Right.
So I think that's probably a good starting point.
Let me ask us another stupid question.
Oh no, you're good.
And I should have asked it a long time ago. Nobody ever said anything. And I just started checking. Are you an Aetna provider?
Yep.
Okay.
Yep.
Okay. I was just curious about that.
Yeah, no, that shouldn't be any problem.
Okay.
Yeah.
Okay. Because, all right. Okay.
So what we'll do is we'll have them get you scheduled for the MRIs to check all that out, and then I'll see you back afterwards. We'll kind of see what that looks like, and then kind of figure out what's the best option.
Okay.
Does that sound good?
Because I've continued with Tai Chi. I just don't do that particular.
That harder stretch, yeah.
Well, I wouldn't say that, but I don't do, because what I was doing was just a real simple thing of where you go here.
Right.
So I mean, it felt good. It didn't feel intense. But I can still do the deep squat. I can still do that.
Right.
And go, and I can do 50 of those.
That's pretty
easy.
Yeah, that's pretty impressive.
So that's what I've been doing, is mostly stuff like
Stuff like that. Okay. Well, as long as you can tolerate it and it's not aggravating it, that's okay.
It seemed like stairs aggravated.
Right.
But which I thought was strange, because I can do the squats all day long, but stairs.
Right. All right. Well, what we'll do is if you give this to them up front, they will get you scheduled for the MRIs, and then they'll get you an appointment to come back afterwards so we can kind of go over it.
Alrighty.
Sound
Thank
good?
you.
It's good to see you.
Thank you.
All right, and just hand that to them up front, okay?
Alrighty.
Have a great day now.
Thank you.
You're welcome. So 77-year-old with left knee pain, really has issues with both sides, pretty severe arthritis on both knees, completely bone on bone. So they're interested in knee replacement. We'll go talk to them and see how we're doing. Hello, hey, how are you?
Fine.
Dr. Logging, nice to
Lita
see
Martin,
you.
it's nice to see
Good to see you. How are you, sir?
Hi, sir. How you doing?
I'm doing good. All right, this is Caitlin. She's my assistant helping me.
Morning.
Well, what's going on?
This left knee.
That left knee.
Oh, yes, sir.
How long has it been bothering
Oh,
you?
well, it's really been pretty bad since March, although previously I was seeing another physician to get injections.
Right.
And over time, you know, it just got
Get
to the
less
point.
and less effective.
Back in March, I had a bout of vertigo.
Oh, no.
For the first time, so I couldn't walk
Right.
for about, I guess, I didn't walk for maybe 8 weeks.
Oh, wow.
So when I decided to try to walk again,
Yep.
it was so painful.
I'm
that
sure.
I had to turn around and go back
Oh.
because it was like I can't explain it, but it was very painful.
Sure.
So,
Oh.
and so I've started researching, doing
Sure.
things on my phone,
Sure.
and you popped up.
Okay.
Jiffy
Yeah.
knee just
Sure.
popped up one day, but the first time I saw it, I just kind of ignored it. But
Right.
then I decided to look into it.
Sure.
Yeah, and I read your information.
Okay.
It's there, and it's less invasive. That's what
Yep.
I like
Yeah.
about it.
Yeah.
Yeah,
It makes a
so-
big difference for recovery
But
for
it's-
sure. So
it's terrible.
I'm sorry. How about the other one?
Well, it's starting to hurt some
Okay,
too.
but nothing like
not
this
like
one?
this one, no. And this isn't every day. It's occasional, but this is constant.
Gotcha.
Yeah.
Can I take a peek
Sure,
at it?
absolutely.
How long's it been since you've had an injection?
March 25th. I looked it up.
Okay,
Yes.
so it's been a little while.
It's been a while. Yes. As a matter of fact, the day that after I left that office after the injection, I thought my knee felt better before I got the shot.
Mm-hmm. Before you got it.
So I got the injection on the 25th, and then the following Sunday, which was the 29th,
Right.
is when the vertigo started. So I wasn't able to keep walking, and I don't know. It just went downhill from there.
Gotcha. Oh, I'm sorry. All right. Well, have you seen the x-rays on your
No,
knees? You've not? All right. Well, these are the ones that we took today, okay? So this is your right knee, this is your left knee, and what we're typically looking at is the amount of space between the two bones, and you can see here on the inside part of the knee especially, I mean, there's just no cartilage left, and so it is completely bone on bone. You've got bone spurs around the edge of the joint, some on the outside too, so that knee's in pretty bad shape. But your right one looks about the same, unfortunately. So it's
So it's on it. So
yeah.
well,
It may be a little bit behind, but it's
coming.
it's coming too. So unfortunately,
you don't do. But do you recommend it?
yeah. So typically, don't recommend doing both at the same time.
Yeah.
Yeah, one, just the recovery's harder, but the main reason for that is when you do both knees at the same time, you don't have a good leg, but your mind subconsciously is going to pick one to be the stronger leg, and so what happens is one knee gets overloaded more in the recovery process, so then you come back 6 months later and you're like, man, this knee's great, man, it feels really good, but this other one is just still stiff and sore, and so it never does quite as well because it gets overloaded.
Right.
So you get a better result if you do one, get it good and recover, and then go back and do the other one. And so usually I tell people, start with the one that's hurting you the worst.
Yes.
So that would be this one, and then just get that out of the way. And then we kind of see how this one does. A lot of times you get this one fixed, this one starts being more noticeable because we've taken away the worst pain.
Right.
But then occasionally I've seen where you get the bad one fixed, then you can put more weight over here, you relieve pressure on that one, and that one settles down for a little bit. So it's possible. So it might last a little bit longer,
Right.
but at some point,
I'm gonna have to.
yeah, because they're both pretty bad.
Yeah.
So the difference in the Jiffy technique versus the traditional technique that most people do, and I know you've done your research on it, but the traditional technique is you make that incision down the center of the knee, and when they do that, they cut into the tendon and muscle. But then you're trying to do therapy and bend it and move it, but the tendon's been cut, so it hurts and it's hard to get the mobility back. So that's what traditionally makes knee replacement take so long to get over. And so with the Jiffy technique, as we come from the inside part of the knee, so the incision's more over here, we avoid cutting into that muscle and tendon altogether. So that helps make the recovery quicker return of mobility and muscle function, and then usually less pain as well. Still a knee replacement, but comparatively the recovery is much better when you don't cut that tendon, which makes sense. So typically you're up and walking right away afterwards. You can put weight on it, move it. Most people will use a walker maybe for a week, and then a cane for a week or two after that. So 2 or 3 weeks you're getting around pretty good, but there's still a fair amount of soreness and swelling that's there. That takes about 3 months for that to kind of fade away. But by 6 weeks, activity-wise, most people are starting to get back to doing most activities they want to do.
Wow.
Yeah.
Okay. When can we do it?
Yeah.
What about physical therapy?
Yep, so we do have her in therapy afterwards. Typically at first we normally do home therapy, so the therapist will come out to the house for a week or so.
Right.
We do usually recommend trying to transition to outpatient therapy as fast as we can,
Sure.
because you typically make faster progress once you get to outpatient therapy. And so, and then how long people do outpatient therapy varies. Most of the time people do it for at least 6 weeks. Sometimes they may want to do it longer, especially if you're making good progress and you're like, I want to keep working on building strength, and I like going, they're nice to me, and so you can go I let people go as long as they want to go and are getting benefit from it. So we just kind of play that by ear, but usually at least 6 weeks of outpatient therapy.
Yeah. All right.
What other questions?
No,
You're just ready?
I'm just ready.
I hear you. Do you want to go ahead and talk to the scheduler to see about trying to get it scheduled?
Yes,
okay.
I do.
All right. Well, come on up here with me and we'll see what we can get worked out for you, okay? All right. Good morning.
Hi.
How we doing?
Good.
Good. You ready?
Oh, absolutely.
Absolutely. How are you, sir?
Fine.
Good.
Ready too.
You're ready too. I hear you. Any questions about anything?
One of the things is I worry about going to the airport and going through security and what's in here.
Yeah, so there will be metal in there, and a lot of times you will set off a metal detector. So we do have cards we can give you that say that you've had a hip replacement to let them know. If you're TSE pre-check and they send you through the metal detector, you probably would set that off. So they'll still pat you down and everything, but we can give you that card to show them. If you go through the other one where you hold your hands up and the little thing goes around, that looks at surface markers, and so typically you won't set that one off. So that one would be fine, but the metal detectors typically you would set off potentially.
What about if you have an MRI or anything?
So MRI is totally fine. So yeah, usually it's a problem with like mechanical devices, so like pacemakers, things like that. But the hip implants, no problems having an MRI.
Okay.
So you're safe on that.
And my vitamin D is low. When can I start back taking it?
Right away.
Perfect.
Yep.
Is D2?
Yes. Yep. How much are you taking?
Well, I've only taken it once because the doctor told me to wait until after my
Till afterwards, yeah. Do you know how many milligrams?
It was 50.
50 mil.
50,000 per week.
Okay, perfect. That's great. Yeah. Yeah, you can go ahead and start that back right away. And that'll help.
Potassium as well.
K.
Yeah.
Right.
Correct, yes. You can start that as well.
Just trying to think, is there anything else I need to ask? I think I'm good.
You're
I
good?
think we do everything just like we did the last one.
Absolutely, absolutely.
Last one was great.
Last one was great. We're going to make this one great too. And working on the left one today, correct?
That's right.
All right, so I'm going to put my initials over here so we all agree.
Okay.
Don't want to work on the other one again.
No.
All right, left side. All right, any other questions? No? Well, can I say a little prayer with you again? Is that okay?
Absolutely.
Heavenly Father, we just come to you again, thankful for your many blessings. And as always, we're so thankful for Carol and ask that you be with her as she undergoes this surgery today. Lord, we hate she's developed the problems in this left hip, and she's done so well with the surgery on her right, and just ask that you allow this surgery to be successful as well, to fix the problems that are there and just take this pain away, and for her to enjoy life without that pain. Be with her again during the recovery period. Just give her patience and allow her to recover well. Lord, we know through you all things are possible. All these things we ask in Jesus' name we pray. Amen. All right, you're so welcome. I will see you shortly, okay? And then when we get done, I'll come and talk to you and let you know everything goes, okay? All right, see you shortly.
Hair. I think that I already had some hip issues, and I fell walking down some steps, and I thought I had broken my hip, and I just kind of, was able to pull myself up and kind of go back to normal, and I was okay. But then I fell again about 2 weeks later out of the shower, and I twisted my other hip. So both hips were pretty much injured, but I'm pretty tough, and it's just like I just kind of blow it off and keep going. And the pain just got to where it was just unbearable. So I had the very first hip replacement from Dr. Logging on January the 7th, and I walked out and it was perfect in 2 weeks. I did the no-no and drove a car and went shopping and did a lot of things that I probably wasn't supposed to do, but I felt good and I didn't hurt like I hurt before. So that's basically it. And so I'm here. This one has progressively gotten worse, my left one. And I think part of that is because, it's just, you don't think you need to go ahead and book for your next appointment. And so I sort of drug that out for a little while and then realized this is not going to get better. I'm going to have this one done too. So I made the appointment after I had I guess it was like a 2-week post-op, and made that appointment. So that's it.
All right, let's take a look at these x-rays. Excellent. So patient's had her right hip replaced and has done well.
Yeah, so 50 cup, 1 stem with a 36-3 head.
On the other side. Okay.
Yeah.
And then obviously you can see, completely bone on bone of that left hip. She does have some subchondral cyst around the bone spurs around the edge of the joint. So definitely in need of a replacement for sure. So
yeah, and then
templates kind of
that's what it should look like.
Pretty much matched up.
Yeah. Looks like it'll be the same sizes.
Excellent.
Yeah.
All right. Well, I think she's going to do great.
Yeah.
She's already got one happy hip, and let's get her another one.
Match and pair.
All right, match and pair. All right, Toby, let's go.
Thanks. Let's go. Matching pair.
Thank you. I apologize. Okay. Now?
Yeah. So you're going to come up here and stand up top. Yep. That's right.
34.
Okay. Come on in with the x-ray. Stem looks great. Okay. To the very top. Perfect. That looks great. Great job, Victoria. Great job. Thank you. Great job, John. Thank you. Thanks, John.
You're welcome.
Thanks, Mike.
Yes, sir.
Appreciate you. Hey, doing good. We're all done. Everything went great. So now she's got a matching pair. So, but yeah, hip was in pretty bad shape, which we knew, but everything turned out perfect. So should do just as well as the other. So they'll get her over to the recovery area here in a little bit, get her situated, and then they'll come give you an update. So just hang tight right here, okay? Yes, sir.
Thank you so much.
You're so welcome. Have a great day, okay? Thanks. Okay, so right knee arthritis, do a cortisone injection, all right? Hello, hey, good morning. How are you? I'm good, how are you?
I'm good.
You're
oh my
good?
Goodness, hello. The knee is right down here.
There you go. Your time for a shot?
Yes.
How's it been?
It's really interesting. I didn't get to my last point in June. It was doing well. And about 2 weeks later, it started this way. It's driving me crazy at night.
Mm-hmm.
Just night.
Yeah.
I mean, during the day, it hurts a little bit once in a while, but mostly at night, I cannot rest.
Oh, that's no good.
But, you know, I take me some Tylenol.
Mm-hmm.
I put me some of that aspirin cream.
Yep.
That's all the stuff in it.
Yep. And that helps?
Rest.
Okay.
I slept 2 hours last night. Not just because of this.
Oh.
Or I would say,
No.
but I'm good.
Okay.
I'm good.
Well, hopefully we put the shot in. Hopefully that'll calm that down for a while.
It will, because the last time when I had my shot,
Mm-hmm.
it was, maybe it was just in my mind, but I just thought it was the best shot I ever had.
Yeah.
And that's why I just kept pushing, because I felt fine when it was time for my appointment.
Yeah, good.
So.
All right. Well, let's try it again, and hopefully this will be the best shot you ever had. Isn't that right? All right, so I'm just gonna feel here. I'm gonna make a little mark. Okay, it's gonna be a stick here, okay? Doing okay. Okay, we're done.
Okay.
Not too bad?
No, not at all.
Good. All right, kind of like before, just take it easy today, okay?
I will.
And then hopefully in a couple days you'll be feeling better with it.
It will be. I thank you.
Yeah, and then do you want to make another appointment for
Yes,
a few months?
I think I will, and then if I need, you know.
We do
2
2 months? All right, so I'll do the same thing. And we'll see how it's doing. Sound good?
It sounds excellent.
Excellent.
Absolutely.
All right, well, if you give this to them up front, they'll get you that appointment, okay?
Thank you.
So good to see you.
You too.
Have a
Take
great
care.
day. You too. Bye-bye.
Bye.
Hello. Hey.
How you doing?
I'm doing good. How are you?
Good to see you.
Good to see you. How you been? It's been a few years.
It's been a few years. Do you mind if I record this so I can recall it?
Yeah, absolutely.
It has been a few years. So I'm in here kind of more on fact finding.
Okay, sure.
So here's what happened in the last few years. You gave me the injection.
Yep.
That helped very much. Thank you.
Good.
It enabled me to get back into my regular exercise routine.
Okay.
Weights, stretching, all of that. Everything was going swimmingly.
Right.
And then starting in about last October, I had a series of international travel and then some surgeries that kept me out of working out or doing anything for about 6 months.
Okay.
Once I finally got over all that, started to try to work out again. Muscles, it's like everything just kind of fell back out of place.
Right.
Started working back out, and what it feels like, I'm going to talk like I know what I'm talking about, but I don't, so stick with me. It feels like it's the same pain, it's the same thing. The hip, and when it really presents itself, it starts at the lower back, and as it gets worse, it really moves into that left hip where you've got the impingement and everything. I'm back into stretching, working on the piriformis muscle and the psoas, which feels good.
Okay.
It kind of loosens everything back up.
Good.
It's enabling me to get back in, weight lift, build back up on my core and all that.
Okay.
So I think I'm moving in the right direction.
Gotcha.
I'm on the right track. Everything's good. So the fact finding, the question is more around the hip at some point. I think last time I was in, you had said, look, it looks like at some point you're probably going to want a hip replacement, whether it's sooner, whether it's later.
Right.
When this happens, and it goes and moves into the left hip, presents there mostly. If I were to do or look at a replacement sooner rather than later, let me rephrase the question. Are the things that are wrong in that hip exacerbating, or to what extent are they exacerbating the problem? And if we were to go in and do something, would it minimize when all of that tightness and everything kind of presents itself, tightens up the back, whatever? Like what? Or
Yeah.
does it say wait till you can't walk anymore, or what?
Well, I'm never of the philosophy to, just keep dealing with it until you're suffering.
Yeah.
I think that's probably taking it a little too far.
Yeah.
Some people would be like, yeah, go till you can't walk or can't do anything. And it's like, what? But then you may go 10 years and just be miserable the whole time. And it's like, that's not worth living.
Concerned also as I continue to age, obviously, with the
Yeah.
recovery period and everything else. Like,
Yeah.
I mean, I can already feel recovery period now is longer than, of course, it was 10 years ago.
Right.
20 years ago.
Sure.
But still able to be active and such. But
Yeah.
be out for whatever 3-6 months of recovery now, as opposed to a year or
Right.
whatever in the future.
Yeah.
So that was kind of the impetus for coming in and saying, okay, is this something, trying to be proactive?
Yep. Looking at the x-rays from today, I mean, you definitely have issues in the hip. The shot helped from before. We could clearly, if you said, well, it's giving me some trouble, we could do another injection because it's been a while and just see if that kind of calms it back down and does okay for you. But at some point, if you said, this thing's just continuing to bother me, I just want to get it fixed. I don't think there's any harm in doing that. The biggest downside to doing the replacement when you're younger is that the replacement parts don't last forever typically, although the one that I use, they do claim last over 30 years.
Okay.
So it does have pretty good longevity. You're young still, so there is the chance, that in your 80s you would have to have something done, but then there's also the chance you may never have to have anything else done to it. So clearly if you waited another 10 years, you probably never have to worry about that for sure, but if it's interfering with your quality of life and you can't do the things you want to do, then there's no point in just putting up with it.
Yeah. Okay. All right. So on the, like I said, right now I'm getting back in with massage and stretching on a daily basis.
Good.
All of that. Like I'm relatively pain free.
Okay,
So long as
good.
I keep on that every day.
Okay,
So I feel
good.
like in another couple of weeks I can be back to
Where you were.
100%.
Okay, good.
So if anything, the injection might just help speed that up a little bit. I don't even know if last time was placebo or if it actually helped or whatever. But
Yeah.
it got me there. But I was in much more pain last time.
Sure.
What are you looking like schedule-wise for the injection?
We could probably do it within a week or so. Clearly we could do it next weekend. I do them on Saturdays when I'm on call, and so that's next Saturday. So we could always do it then, for sure. Within a week probably.
All right, in shaping?
Yep.
All right, I'll go ahead and do that. It'll just help
Yeah.
speed things up. And then I'll put thought around the head. I just don't want to wait until it gets, because man, when it's bad, like when I called, that's when it was kind of at its tip. When I called, made the appointment.
That's when it was really bad. Yeah. At least it's kind of settled down, but.
Yeah, and I think I've just been dealing with it long enough too that I know my body, I know what's going on, and I know what to work on, and I just have to work through it. And part of that is mental as well, and stress and all of that.
Right.
Just kind of like telling my body to just chill a bit.
All right, so we'll schedule you for the injection. Do you want to make an appointment after the injection just to kind of see how it does, or do you want to just call me if it's not better? Okay.
Let's see where it goes.
All right, well, come on up here with me and we'll go have her get this scheduled for you, okay?
Yeah.
I'm gonna head down this way.
Robert, peace.
Nice.
The first days are rough, but it wasn't as bad as I thought they would be. I was able to get around a little bit, but I just took the biggest problem was you just got to be patient. You can't just get up and go. You got to wait for them to come get you up and all that, man. That was also something to get used to because you know, you got to be immobilized. You really just can't go up and do things. My wife is a nurse, so she made sure I was following all the rules, all the direction. She didn't let me do anything I wasn't supposed to do, so it was okay, but physical therapy helped out a lot when they came to the house. I was major. I wouldn't have stuck to the rules that they wanted me to, you know, the immobilization. I would have been going everywhere, but luckily she was right there to give me the ice when I needed, to get me up and things like that. It was within a week. I was able to get up and walk my own. I mean, after a few days, I'd say within a week, I didn't even need a cane. But I did use it just because it was, sometimes the turning, you got to get used to the turning. Your leg is still swollen and physical therapy. I went back to work. I work for a nonprofit, but I went back last week after about 4 or 5 weeks, I think, last week. Going on short walks. My wife had always been walking the dog. We have 2 dogs, and she's been walking the dogs. But I've been going out and walking the dogs with her. So that's awesome to go out and do stuff like that. I tell you, before I went through this, I was in such pain. I'd be willing to do anything. So we finally decided, yeah, we'll go and try to get it. I would suggest getting it. I mean, it's not walk in the park, like I said. I went to Newberry General Hospital for the surgery, and they had everything in line for you. But after that, you know, if you follow directions, do what they tell you to do. But ice was my big thing. You gotta get ice because to keep the swelling down, and pay attention to physical therapy. I would encourage people to do this.
6 weeks right total knee. X-rays look really good. So good alignment. Hello. How are you, sir?
Doing well.
Doing good? Making progress?
Yeah, I believe so.
You believe so? Let's take a peek at it. How's the therapy going?
Therapy's good. I had it this morning.
Did you?
Yeah.
They worked you out?
Oh, yeah.
Incision's looking great, man. That's healing really nicely. Swelling's?
A friend of mine works for Vitals.
Yeah,
She's a wound nurse there.
Yep.
She told us to put some vitamin E on.
Yep. And it's looking really good. Yeah, real proud of you on the progress. I mean, your mobility looks excellent. I mean, so for 6 weeks, I mean, we're really coming along good. X-rays look great. So, I mean, I'm really proud of you. I think you're making great progress.
The only thing I have a problem with is going upstairs. It's really right there.
Yep. And so most of that is unfortunately just due to the weakness that's still there. And so for stairs, I usually tell people for it to really get comfortable and fluid, it takes a good 6 months.
Okay.
And part of that is because that's what it takes to really get all that strength.
Well, we worked on that
up.
this morning. The
little smaller steps.
The blocks. The one about that high is a little rough. She got the one about that. That worked out fine.
Good.
So I'm getting there. It's gonna take a while. I'm losing weight.
Good for
slowly,
you.
But it's going.
Yeah. Good for you. I'm proud of you. I think you're making great progress.
Yeah.
So you're working hard and things are heading in the right direction.
You did a pretty good job.
Well, good. Well, thank you. Any questions about anything?
No, I think I was just asked about that pain. Would you explain that?
Yep.
The swelling's still there, but like y'all said,
Yeah, it really
Georgia
takes
said
about
last
3
time.
months
Yeah,
for
that's
that
what
to
she
kind of
said.
gonna go away. So, but for 6 weeks where we are, I mean, it's really not bad at all.
I'm
So-
going, I mean, before I could barely walk, without pain. Now I can walk anywhere.
Yeah, good for
But
you.
there is some discomfort there every now and then, but
Nothing like it was.
nothing like that.
Good. All right, well, I'm going to check you back in a couple months, okay? Just so we can make sure everything's still making good progress. But I'm proud of you.
Appreciate it.
Yes, sir. So
So
if you-
looking at that bridge walk in that April, I think.
good for you.
See what we can do with that.
Yeah, you should do it. That'd be amazing.
Yeah.
Well, let me know if you do it. I want to see some pictures, okay? That's awesome. All right, well, if you give this to them up front,
Sure will.
they'll get you that appointment. We'll check back. But I'm really proud of you. You look great. Okay, so we just finished our office here at our Palmetto Bone and Joint Irmo office location. We had a really great day. It's a pretty busy day. A lot of patients. We scheduled a ton of surgery for patients today, as well as seeing a lot of patients for follow-up. It was a great day overall. Didn't really have anything too challenging, and so just real happy with the day overall. So about to head home and then get a little relaxation in for the weekend.